Okay, hello everyone. Welcome to our webinar on living well with scleroderma. Um, my name is Ryan Hadlow, and I'm the Information and Support Manager at Scleroderma and Raynaud's UK. So I'm in charge of organising the webinar program. Feel free to leave comments on any future webinars you may like to see. And you can also email us at info@sruk.co.uk. Today we have Will Gregory giving us a presentation. He's a consultant physiotherapist in the rheumatology department at the Salford Royal. So it's a pleasure to have you here today, Will. At the end of the presentation, we will have a Q&A part where you can drop in any questions you may have in the Q&A tab at the bottom there. So yeah, just try and think of some questions to ask Will here, and they'll be fielded. Yeah, and without further ado, I'll pass on to Will.
Thanks very much, Ryan, for the introduction, and to you and all at SRUK for this invite to present. I've just celebrated 20 years of working in scleroderma, which is something, working at Salford Royal Hospital in Greater Manchester. If you have been to SRUK events before and seen me speak, you will see some familiarity with 20 years. I do sometimes talk about stuff that's from 10 years ago, but hopefully I'll be updating you on all the bits and pieces that have come through in the last few years that will help you improve your living with scleroderma, essentially. So I am a physiotherapist, so I will be talking a little bit about physiotherapy, but you could also call that physical activity. You could call it just plain exercise, whichever you like to call it. Those are the things we'll be talking through. I'm just going to take a moment to get the slides up and running, and this is always the most nervous part of the presentation for me, I should say. So let's see if they're going to come up and behave for us. Okay, I can see the slides, and that is promising. And let's see if we can get them playing. So just whilst that's loading up, you might want to have a little think about what you're currently doing with regards to your day-to-day routines. What are you doing that could be working from an exercise point of view? What you're doing that you would call exercise or not call exercise, and how are those habits maintained? Who keeps an eye on whether you're doing them? How do you keep yourself motivated and such like? Now let's get this slideshow actually up and running. I don't think that's quite done the business. Excuse me a moment. Okay, that's looking a little bit better my end. I'm going to come to Ryan and check the look at everyone at full size.
Yeah, that seems to be working now.
Fabulous. We are out of the woods, the water. Now at this stage, and without too much further ado, we will get going. So we're going to talk about living well with your scleroderma, an update on exercise, movement, and physical activity. So we're going to think a little bit about the evolving evidence base behind rehabilitation in scleroderma and how people living with scleroderma can apply this kind of enhanced rehabilitation and get benefits from that, but also sustain those outputs. Please do feel free to write things in the chat. We will be going through the questions probably at the end of the session, but if there's anything that comes through and I spot it whilst doing the slides, I will try and answer it live. So I can see that Liz has just asked, are there any other physiotherapists specialising in scleroderma in the UK? Yes, there are a few. There are about 330 physiotherapists with an expressed interest in rheumatology across the UK. Not all of them will see scleroderma as part of that rheumatology interest, but lots of them will. And certainly I write to them once a month because I run the newsletter for that group. So I do put lots of scleroderma in there. So there should be a physiotherapist near to you who has a good understanding of inflammatory arthritis and that broader rheumatology conditions, but maybe needs a little bit more of a tweak for scleroderma. And there's no harm in taking some of these slides or some of the information off the SRUK website to your physiotherapist locally and saying, look, this is the stuff I'd like to work on. What do you think? And we will come through that a little bit as we talk on today's session. I say today's session, I think this is being recorded, so if you're not joining us live, sorry that we can't answer your questions live, but please do send stuff in through the usual channels to SRUK. We're going to talk for probably about 20, 30 minutes. I'm then going to lead you all in 2 different 5-minute exercise sessions, both which you can do sat down comfortably. So one will focus on your hand and wrist function, and the other one will focus on your mouth and facial stretches. So some nice things to trial there. So let's see if the slides are now behaving. Yeah, good. Okay, so just a little introduction of where I'm joining you from. So this is our hospital at Salford Royal. There's a very old picture from, I think, about 20 or so years ago, and some of the staff are still there in the Salford team. We have got a few new faces since then, and I should have found an updated photo, but I always think it's quite funny to look back on the years we've had in our department. And if you know our team, you will see how we've all aged since there. So there are a small number of specialist rheumatology departments treating scleroderma in the UK, and this goes back to Liz's question. So if you are near to Bath or the Royal Free in London or Glasgow, you may well have a specialist scleroderma physiotherapy team. Outside of those centres, Leeds, I should have mentioned Leeds, excuse me. Outside of those centres, it's a bit more ad hoc, the support you will receive. But I have been caught out before. We used to run an inpatient service and for our scleroderma patients, and early in diagnosis, they would come and stay for 2 or 3 days on one of our investigation units and see the whole team. And I had a lady come and join us from one of the very remote islands in Scotland. And she said, oh, yeah, my physiotherapist looks after me locally. I said, oh, great. Do they know scleroderma? Oh, yes, actually, they're a specialist in scleroderma because they used to work at one of these centres. So there are even rheumatology specialist scleroderma physios up in the most northern islands of our United Kingdom. So you might find someone nearby who has a specialism, and if not, work with them to support that. And we will get physiotherapists who can deliver the kind of treatments I'm going to talk about, even if they've not seen scleroderma so much before. So I just wanted to take you on a little bit of a world tour, and you will see little flags on some of my slides over the next 10, 15 minutes or so. And this is meant to represent the whole world. The flag image I've put on this one. And this is the Global Fellowship on Rehabilitation and Exercise in Systemic Sclerosis. This systemic sclerosis being the broader term for scleroderma. And this at least reassures you, this is a few years ago, but this reassures you there's lots of people thinking about this. And whilst we are very keen that there's an answer to scleroderma and perhaps a medicine that improves it or a cure in the future, the focus for us as physiotherapists and other allied health professionals is how can we make life better for those people living with this condition? And that's where the rehabilitation picture comes in. So there is a global workforce on that. And I think by looking at things on a global picture, we've got a much louder voice and a bigger remit to hopefully push for change and improvements in kind of how you experience living with this condition. I'm not expecting anyone particularly to read all of the tiny text on this slide, but just to reassure you, as part of that global rehabilitation workforce, there was this document that described how exercise might help in quite a number of different elements of your scleroderma. So There is consideration it could help with the inflammation, it can help with fatigue, with sleep problems, it can help with cold sensations and your Raynaud's phenomenon, it can help with your gastrointestinal issues, it can help with your skin tightness, it can help with muscle strength, and it can help with your pain, just to list out a few of those on there. So we do feel having regular physical activity habits will have impacts across quite a lot of different areas of your scleroderma. So what's actually happening? And this is a survey that was done a couple of years ago in the Netherlands, and they looked at what are people living with scleroderma actually doing on a day-to-day basis for their kind of habits of self-treatment or exercises, essentially. And these are scores out of pretty much 100 in that table there. So the winning one, with just over 72% of respondents saying, yes, I do that, is muscle strengthening exercises. In second place, range of movement exercises, so stretches where you're trying to keep movement going. In third place is aerobic exercises, so things that get you slightly short of breath, which could be a walk or a jog or a bike ride or whatever it may be that just gets the hearts and lungs pushing a bit. In fourth place is balance exercises, and then going down to the mid-tens of percentage. So about 1 in 8 people said they were doing regular hand exercises, about 1 in 12 are doing regular mouth exercises. And then there's a little mention here of swallow exercises, relaxation techniques, and hydrotherapy. So that warm water exercise that can be quite useful for people living with scleroderma. Of course, hydrotherapy and other moist treatments like that are problematic if you're struggling with ulcers, because there is that problem of being in water that could impact negatively on the ulcer. So not every treatment is for everyone, but the overall use of physical therapy isn't nearly as much as we would like from this survey. So we would like to think that you're all keen to do your exercises, see the benefit of them, and they become a habit for more than whatever that is, maybe 50% overall of people living with this diagnosis. So that's the picture in the Netherlands. I suspect it's quite similar in the UK, that we've got some people who are dedicated and know what to do and push themselves, and others that are either struggling due to the condition or haven't had that education or kind of support to add a regular habit that should help. And that's the thing, is if you feel it's helping, you'll probably keep doing it. If you're not sure it's helping, that's harder then to commit to it when you probably have lots of other self-care elements you need to add into your day-to-day routine. So I'm going to talk through 4 areas where the research has really looked at what physiotherapy, what exercise, what physical activity can do to improve outcomes for people living with scleroderma. So we'll talk about hand and finger exercises. And like I say, we're hoping to do a practical session on that a little bit later in today's session. We'll talk about cardiovascular fitness work, which is walking or bike riding, or as this lady's doing on the picture, this is an arm ergometer, so bike riding with your arms essentially, and some kind of fitness facility. We'll also mention facial exercises, because we know that those tightenings around the mouth and the lips can be very restrictive and impact on quite a few issues. And then the last bit in the research that's worth just touching upon is an Italian study that looked at manual therapy and massage as a potential improvement aid. But as I will mention in a moment, not everyone has access, and not everyone necessarily needs access to such treatments. So why am I talking about this? Again, I'm not expecting you to read all the text here, but this was a survey a couple of years ago where they looked at every single piece of research worldwide that's looked at exercises in scleroderma, and it came up with, what number we're on, 16 papers, so pieces of research that have been undertaken looking at the impact of exercise. And the top one, I think just alphabetically, is me and our team at Salford. So this was a project we did a few years ago that was funded essentially by SRUK, or one of its predecessor organisations, where we looked at exercises and an alternative heat treatment to see what impact it would have. So it is a shame, when there's lots of scientists looking at lots of areas, we've only got 16 papers published that demonstrate the impact or lack of various treatments for scleroderma. So that's hopefully why I'm talking. That's also another chance for me to say thank you very much to SRUK for funding this piece of research we did a few years ago out of Salford. So hand and finger stretches. Well, the first thing to mention, and this is Ariane Herrick, who was the consultant rheumatologist at Salford looking after scleroderma patients for 33 years. She actually left a couple of years ago and is very missed, but very well replaced by Dr. Hughes and Dr. Samaraniaka. But this looked at what happens to your skin over time from when you get diagnosed. And the graph here, we've got a green line, a blue line, and an orange line, and they represent how thick your skin is after diagnosis for the first 4 years or so. And the different colors represent three different subgroups of people living with scleroderma. So if you're in the orange subgroup, your skin tightens over the first 12 to 18 months, and it stays pretty tight. If you're in the blue group, it tightens, but around year 2, after the scleroderma starts, it starts to loosen off a little bit. And in the green, it starts to loosen off, but less dramatically so after 2.5 years. And the reason I share this is a significant change to your capabilities when the condition starts. It impacts what you can do, and it can feel like a struggle. But just to reassure, we do see improvements in movement after a while of the diagnosis. Maybe at 2, 3 years, we start to see for some people, if you're in the blue or the green there, movements start to get a little bit easier as that tightening up issue of the scleroderma starts to loosen. And that's probably related to the excellent medications and other bits and pieces, but it does give us an angle from a physiotherapy point of view to think about when we're best to see you and support you to get things moving again. And normally we're a little bit cautious in the first year or two of not overstretching or over pushing on the movements, but then we get this quite good period after 2 or 3 years where the stretches work better and the movement starts to return to a degree. Now you'll notice the green line goes pretty much back to pre-diagnosis, whereas the orange and blue, there is persistent ongoing limitation due to the tightness there. So this isn't a pure recovery story, but there's certainly an angle for improvement at some time in that post-diagnosis period for a decent chunk of the people we work with. So I do hope that if you're watching this and you're within that first couple of years post-diagnosis, that you are a blue or a green and you start to feel the movement coming back in the next few months. And if you do, that's the time to really push those exercises to maximize the benefits of the increased flexibility that can come at that period. I did say I was going to talk about hand exercises, and we're going back 20 years. We're heading off to Sweden on our world tour now, and this was the first paper that significantly showed changes for stretches of the fingers. And what's crucial here, if you look at the pictures, and hopefully you can pick this up, is we're using one hand to stretch the other hand. And that's the bit that looks from the research to be the best thing, is when you stretch, you need to push that stretch with something external, which will usually be, if you're stretching a finger, use the other hand to push that finger a bit further. This relies on you having good enough hand function in each hand to push, the other one that you are stretching. So that was reassuring. This was also important to note from this study that actually the hands got a bit more painful over that 2-month period whilst doing the exercises, not so much that it concerned and the improvement in movement paid off for that discomfort during that period. So as the movement starts to return, if you're taking on a stretch routine, it can be uncomfortable, not painful per se, but uncomfortable as the movements start to come back. At the end of that period, when the movements have returned to a degree, that pain of the improvements settles down to a pre-treatment level. But just to be aware, we would expect when you start a new exercise routine, it could be a bit uncomfortable for the first few weeks. A bit uncomfortable is fine. Absolute agony means we need to look at you and check what's going on and how else we could adapt it. We then moved into the 2010s. So this is about 10 years ago. They did a more comprehensive study in the Netherlands, and they found a combination of stretches, education sessions, and fitness work improved quality of life. And that's probably the thing we most care about. Whilst we do measure our patients' hand movements and mouth opening, as you'll see, all of that is somewhat scientific. What we actually want to see is life easier for you? Are you getting on better with the diagnosis? Have you got some of the things you like to do in your life back in your life again? So this is promising that we're doing the exercises not just for the sake of improved capabilities of exercises, but for better life, better ability to do what you want to do. So on the subject of hand exercises, this is the study that we did at Salford, where we specifically looked at wax bath therapy with hand exercises for people living with scleroderma. And that was based on a lot of discussions with SRUK about what kind of research would people living with scleroderma who are members of SRUK want to see. And it was the wax bath that was mentioned very regularly. The study did find that the exercises improved hand movement for almost everyone who went through the trial. What it did not find was any further benefit of adding the wax bath to the hand exercises. We were hoping it might do, in which case we could have said, look, we need to prescribe wax baths for everyone because it'll help. But we've not been able to say that. What we can say is it might help you. As I said earlier, with a wax bath, if you do have digital ulcers, so skin breakdown, you can't use it. So it is a bit limited when we're seeing 20 to 30 people living with scleroderma having those kind of hand ulcers. But if your skin is clear and it's something you wanted to trial, it might help, but we've not proved that scientifically. Interestingly, when we presented this at the World Scleroderma Congress, next door to us was a Danish group who'd done essentially the same study. They didn't use paraffin for all of their patients. They used lukewarm water for some, but again, they found hand exercise is helpful. The addition of hot wax or hot water didn't boost that benefit particularly. I'd still say it's good to do your exercises after a hot bath or a hot shower, or if it's hand exercises, putting your hands in warm water because it loosens it up. But that is variable from person to person and not always shown to help. So stick to your own habits of hot or cold before your exercises was the conclusion of our study, but certainly the hand exercises do help. Which leads me to what hand exercises did we do? And we are going to practice these together a bit later in today's session. The hand exercises we chose in our trial were based on this study out of Japan, where it showed the most long-term and significant improvement in hand movement with these 3 stretches. And as you can see, hopefully from the pictures, we're pushing each of those fingers into the stretch, either curling up or pushing backwards or pushing on the knuckle. And what was really nice about this study in Japan, and we found it as well in Salford, so that's reassuring, is a month's worth of stretches still had benefit when was retested at a year. Now, that either means a month of exercises were still helping a year down the line, or actually, as we found in Salford, as I think they found in the Japanese study, is the exercises became habitual. Because they're quite simple, you can do them when you're sat at a desk. You can do them if you're stuck in traffic lights for 5 minutes when you're driving somewhere. You can just stretch the fingers. And because it became a habit, the benefits were still there a year later. And this is what we want to find for you, is an exercise routine that becomes a habit and takes a few minutes and is something that just fits in to your day-to-day life. So we'll move on to facial stretches next. And like I say, this is a problem in that we see quite a few people have this skin tightening around the mouth, on the lips. And we have found, or it has been found, this is a Canadian study, that limitation to mouth movement can impact on your mood. And we know if your mouth doesn't open fully, that can make it harder to speak as clearly. It can also impact on your eating ability, and it can impact, and perhaps I don't need to tell you this, those of you living with it, but it can impact on your visits to your dentist. The study from where are we going now? The Netherlands described about 7% of people living with scleroderma having microstomia. So that's a mouth opening of less than 35 millimeters. But from my experience, I would say it's 20 or so % of our patients at Salford who have limitations of mouth opening that is significant and we can help with. And that may not be the strict definition of microstomia, but this is something that's quite a common issue. And I think we can improve with that. So what's been found? Well, the first study was 1984, so this is 40 years ago, where it was found in America that auto-assisted mouth stretches helped. So auto-assisted is when you get your hands in your mouth to increase the stretch, or as per the bottom right here, you use a splint to hold the mouth open, essentially, and we'll talk about that in a moment. On the bottom left, we can see the latest kind of option that we looked at in the UK, but we never quite got round to trialing it. And the Belgian team have fortunately looked at this, which is a device that holds the mouth open, splints the mouth open to give that sustained stretch. We'll come back to that in a moment when we do our practical session. And Ruth has just asked, can we have a copy of the slides? Yes, I'm more than happy to share the slides. No concerns from my point of view. So we'll see what the team at SR UK say about that. There is a recording of this that will be available for you to watch again. So the final study that's worth mentioning, and this is interesting in that the Italian group got a really good funding stream for their rehabilitation and did 3 studies within a couple of years. And they did show the benefits of the hand stretches and also of some fitness work. But one of the angles they did have in there was this kind of manual therapy or massage work, which was found to be fairly effective. The challenge for us is it was 18 sessions, each of them an hour long, and happening, I think, over 9 weeks, so twice a week, an hour-long treatment. Now, that's not something I'm afraid to say the NHS could replicate. And I think if you were sourcing this privately, that would cost a lot of money. And the benefits that were found aren't much better than doing the exercises yourself at home. So if you are sat here as a multimillionaire, then it's an option. But I think if you're not, then I would just reassure you that massage type treatments that you may have to pay for probably aren't worth the money because the benefit isn't sustained and could be achieved with some exercises performed by yourself. Obviously, if you live with a massage therapist and they want to treat you twice a week, that's another option. But on balance, it's not something we've pursued in NHS services. Something we are pursuing and very aggressively now, really, across a lot of rheumatology diagnoses, is the ability to better improve your inflammation by means of cardiovascular fitness work. And this has really changed what we do in physiotherapy over the last 10 years or so, as more and more studies have come out showing not only do we need to think about stretching work and balance work, but actually if we get your heart and lungs working as best they can and improve general fitness, that has an impact on controlling the inflammation of the scleroderma. And there's a number of trials here, and we're going on a bit of a world tour here across Belgium, Italy, Sweden, and back to the UK, where it's been found that people living with scleroderma can improve their fitness work. There's treadmill exercises here, there's exercise bike work, there's arm crank work, which is the picture I showed you a bit earlier. And all of them have shown improvements in fitness, muscle strength, and quality of life from those kind of excuse me, from those kind of exercises. The crucial bit here is some of you will be living with limitations to your lungs as a part of the scleroderma. And there's a really nice study a few years ago that compared how much can you do with those scleroderma specific lung restrictions. Well, yes, we can still get improvements in fitness levels, even if you are rather limited by your lung capabilities. We can still improve those outcomes. So no matter what your starting point is, improving your general fitness will improve your scleroderma, even if it takes a while. So those are the 4 areas that the research has looked at to date. So the hand exercises, the fitness work, the facial stretches, and the massage story there as well. But how are you going to make it happen? And this is the challenge, I think, for all of us who are humans. We are challenged to be as active as we should be. And I'm as guilty as anyone in that I don't do as much fitness work as I perhaps should do or could do because life gets in the way. And living in Manchester, the rainy weather quite often gets in the way. But there are ways to do your exercise that are flexible. And Ruth in the chat's just mentioned potentially a treadmill as an option, which, yeah, I think that is a decent idea because it will allow you to work on those exercise levels and get improvements from that. I should say I don't work for any companies that sell any of the things I'm suggesting here, but anything that improves your ability to commit to the exercises and the routines is useful. If you go onto the SRUK website, you will find a version of this booklet that I first wrote in 2006. So it's 18 years old. It's just reached adulthood, this booklet. So it is a broad program of stretches and a little bit of advice on cardiovascular work and balance exercises, as well as strength work for your scleroderma. So it's a broad brush, simple routine. And I've been providing it for all that time to people I work with who are living with scleroderma. And I've said, perhaps at the moment, if it's only your hands that are limited, you might look at this routine once a month and just check how are you doing for the flexibility of your hips and your knees and your shoulder and such like. You can find it. I think this is what it looks like at the website at the moment, so you can log on and have a look at that. I will be mentioning a different exercise resource in a moment, though. So this is the science behind what we do. Well, the first thing we do know from studies, and this is the global force on rehabilitation, which has shown that physical inactivity contributes significantly to the overall burden of living with scleroderma. So that challenge in doing as much activity as you could, or the scleroderma allows you to, can significantly change the outcome. So that's a challenge. The other bit, and this is normally a statement I put in when I'm talking to people who are healthcare professionals, but I think it's important for you guys as well, in that there was this patient survey a few years ago that suggests your doctor, your physiotherapist, your GP, your rheumatologist telling you about your exercise habits or asking you and suggesting improvements is very helpful, particularly if it's early after diagnosis. So we do try and get physiotherapy involved as soon as possible after diagnosis to just reassure people who've just developed scleroderma that they can exercise and that they should exercise. And like I've said, ritualizing it, becoming a habit is important there. So if you're thinking about your fitness work, and this could be just having a walk locally or running up and down your stairs or whatever it may be, it is worth just thinking about how you build yourself up for that fitness work. So this is an example where somebody is just thinking of walking slowly on level ground. On day one, they do 6 minutes and see how it went, knowing that on day two, they're going to do 4 minutes. And then on day three, they might have found that Goldilocks answer with, well, 6 minutes is a bit too much. 4 minutes wasn't quite enough, so I'm going to try 5 minutes, and that will be my target on a daily basis for now. And then perhaps after a month, we'll take that up a bit. So finding the right level for you. And the risk potentially is if you're starting a new exercise habit, might you accidentally or inadvertently overdo it? And then that will put yourself off doing it again. So start slow and gradually build up. So this is a graphical representation of this. This is actually one of the people I've worked with a number of years ago, where we gave them targets for their exercise, and the purplish line in the middle was the ideal. Orange was, if you're on a bad day, just try and do that orange. And if you're on a good day, the darker blue color there was, this is the maximum you should do. Even if you're on a good day, don't overdo it. And then the yellow line is what they actually did. And this was step count, where we were gradually building that up as a level to increase that fitness. How can you make it happen? Well, do you need to measure what you're doing for your activities? So it could be like that example, how far you walk. It could be how many repetitions of each of the exercises you're doing. I'd ask you, if you have got an exercise routine, is it sustainable? Do you think you could do it long term? As a part of that, is it fun? Are you doing it with other people? Is there someone else who you are accountable who says, have you done your exercises today? Or how did you get on with them today? With your routine, are you thinking about fitness, flexibility, or strength, or all three of them? What happens if you're on a bad day? Do you give yourself a day off? Do you do a little bit less? And then are you meeting the UK physical activity guidelines, which is either 75 minutes of more intensive cardiovascular work or 150 minutes of moderate work per week? At this point, I normally mention Captain Sir Tim Moore, who you may remember a number of years ago wanted to do, I think, 100 steps for his 100th birthday was what he challenged himself. And he said, I'm going to do 100 steps for my 100th birthday, and I'd like to raise £1,000. That was his goal. As you may remember from the news story, on his 100th birthday, the total he'd raised was 30 million. So quite a significant upgrade on what he thought he might manage. But by starting slow and having a regular habit, he was able to deliver the improvement that he hoped he would do with his walking. Just to kind of step away from that a little bit and think about the terminology I've been using. So exercise is planned, repetitive engagement that targets improving health, whereas physical activity includes the unplanned movement we do throughout the day. And of course, both of those are good for the outcomes we want to achieve. So I did mention another program. So we have got the SRUK website with a short, brief program. We were just looking at upgrading it when this dropped in our email box a few years ago. And this is the French physiotherapy exercise program, which I must say is very well thought out. The pictures are, I think, really helpful. It's people who are living with scleroderma doing the exercises. And I think it runs up to about 100 or so exercises within it. That does not mean you have to do all 100 exercises on a daily basis. But if you're going to a physiotherapist, perhaps who doesn't know scleroderma so well, they can help you identify which are the key areas for you to be working on by looking through the routine and comparing them to the issues you have in that assessment. So I've talked probably enough at this point. It's time for a bit of action, although I should say the person on this video I'm about to show you is also me, but from a few years ago, so you're still going to have to listen to my voice a little bit. This is advertised as a 5-minute video on the SRUK website. It's actually 9 minutes in total, because there's about 2 or 3 minutes of me waffling, much as I've just done in the last 30 minutes before it starts. So I'm going to play the video, jump in at about the second minute, and then I'm going to ask you all to join in, because we do have one of our expert patients joining in this video, and try that hand stretch routine all together for us here over the next few minutes.
Sage can help HR champions spend more time bringing the team together. Sage, helping business flow. With the new Dexcom ONE Plus, your glucose numbers go where you go. It's an easier and more discreet way to manage diabetes with all.
The exercises are evidence-based. Look at straightening the fingers as best as we can. As I've said, the best way to stretch is by forcing the finger with the other hand. So hopefully you've got enough hand function to do this. If not, you can ask a family member, a household member or a friend to help you. But starting with your index finger for me, if you could lift up under the pad of the index finger and try and get that finger as straight as possible. Yeah, great. And with all of these stretches, we're holding for 10 seconds. Okay, and then we'll move through to the middle finger next. Same routine, lifting it up and trying to get it as straight as possible. Where are you feeling the stretch there, Una?
Just there, if you can see where it's white.
Yeah, quite distinct of the stretch under the skin there, isn't it?
Yeah.
But of course, you'll always feel the stretch at the tightest part, which is fine.
Yeah.
Okay, we'll move on to the ring finger next. And again, pushing that up straight as far as we can. And finally, the little finger, same stretch there. Okay, so we'll do the same for the other side. So this time it's the left hand being stretched, the right hand is grabbing hold of the pad of that fingertip and lifting it up as best you can. Yeah, great. So we're going to let Una take herself through that hand and just talk through as you stretch for 10 seconds on each. I'll let you know so we can move on to the next finger now. So Una, you said you've recently seen an occupational therapist for your hands with your scleroderma.
Yes, I'd finally seen one there at the start of May, and she made me molds for my hands so that I can put them on at night time and wear them in bed, you know, hopefully preventing my fingers from curling any further.
Yeah. And I think that's a realistic target, to our goal being, let's make sure things don't get worse. But equally, we can improve movements. Normally after the first 18 months is the best time to see movements suddenly come back. And we don't know if that's due to the disease course or the medications you may have started, but first 18 months go slowly. After that period, we can start to see the benefits. Thanks very much, Una. So that's the fingers straightened as far as they can. We're going to do the opposite now. So we're curling. We'll start again on the right hand index finger, curling the finger in as far as you can. So it's almost touching, or if possible, touching the pad of the hand. Now, don't worry if you can't make it touch. It's just trying to get that stretch as close as possible. And for some of you, when you see your rheumatologist, you might have that measured, the distance between the pad of your hand and the tip of your finger. And again, we can see that whitening as the skin is really stretched there on the knuckles, can't we? Okay, that's 10 seconds. Thanks very much, Una. Should we move on to the middle finger next? And we've mentioned your occupational therapist. I should mention, for some places it's the physiotherapist, for others it's the occupational therapist who leads on the hand stretch routine. But we would highly recommend you see those members of the team as soon as possible, really, depending on access in your local centre. We'll move on to the ring finger now. Thanks, Una. Ask your rheumatologist for a referral to your occupational therapist, your hand therapist, or your physiotherapist to have a review of your stretches. And even if your movement's fine, there's no reason you can't see us and get some advice of how we would stretch and kind of keep things ticking over.
Yeah.
And we're on to the little finger now. Thank you very much. Okay, we'll move over to the left hand, and again, starting on the index finger. How are these feeling for you, Una?
They just feel very tight.
Okay, so I hope that you found that a useful introduction to hand exercises if you've not done them before. And crucially, that is available on the website if you'd like to go back and review what we did there together. Now, this is where my slides have slightly disappeared, so excuse me just a moment whilst I try and get back. Yeah, I think we are there. So if that was the hand exercises, and I do hope the audio came through well enough there, we're now going to look at the mouth exercises. So like I said, it's quite a frequent issue for people with scleroderma that their mouth does tighten up. And as I said, it can impact on your eating, your visits to the dentist, and also your talking as well. So this is from the Tufts School of Dental Medicine, where they found about 28% of people were struggling to find a dentist who was prepared to treat them because they were living with scleroderma. And 63% of the respondents said they would not recommend their current dentist to other scleroderma patients. So I don't know if that is a common issue in our audience today, but certainly this is a concern and something we would like to make easier for you, not only having a dentist who helps, but also being able to get through the treatments that might be required. I mentioned that we do measure mouth opening in our clinic, and this is the kind of tool we use. It measures between the bottom of the top teeth and the top of the lower teeth, and it gives us an overall movement in millimeters for that stretch. And anything less than 30, like I say, is microstomia. But I would say anyone under 45 if you're female, or under 50 if you're male, will actually find improvements to some of these outcomes by doing a bit of a regular stretch routine. There is some information on the SRUK website on this. This is what it used to look like. I think it's been slightly rebranded, but it mentions how you might warm up for the exercise. And I mentioned a hot shower, a hot bath. It could be a warm flannel on the area, just loosens up your mouth. I'm going to assume you're somewhat warmed up from the hand exercises you've just done, and we'll go pretty much straight into these mouth exercises. And they break down into 3 components. The first group are called facial grimacing, where we're going to do unusual facial positions together. The second is oral, excuse me, is oral stretches, where we're going to put hands in the mouth if the hands are up to it and stretch out. And the oral augmentation I'm going to show you, but we're not going to perform it together as a group. This chap at the bottom is the Guinness World Record holder for mouth opening. I am not expecting any of you to perform that level of mouth stretch as we go through the routine together. I'm very sorry to say I can't see you doing these exercises today. So that's a shame that we can't share our capabilities of doing this routine. But maybe it might make you a bit more free in undertaking this if you know you're not being filmed, which is probably the better option. Before we go into that, I just wanted to profile these mouth stretch exercises that the Belgian team were looking at. And we think they may be helpful, but rather like the wax bath, the science hasn't supported their use just yet. And it looks like the tongue depressors I'm going to mention are as good as this more expensive option. So, when you're ready, I'd like you to all firstly open your mouth as wide as possible. And once you've held for a few seconds, we'll close the mouth back down and we're going for option 2, exercise 2. The same exercise, but this time you're curling your lips, if you can, around your teeth. So the lips are getting more of a stretch as you then open your mouth as far as you can again. The images, I should say, I found online, I had to do myself. The next one, if you pop your hand, if you can, on your jaw and just pull the jaw down, grabbing onto the bone there to a degree, and again, pull that stretch a little bit. It can help with the joints at the top of the jaw, but it's meant to just stretch off this tissue around the mouth, around the lips. Next exercise, you're pursing your lips, so pushing the lips together so you try and hide them. You can see these slides are a little bit dated because this was the President of the United States when I put these slides together first time. Okay, once you've held that, and if your lips aren't too sore to do this, that's the other issue. If there is skin breakdown there, you need to be a bit cautious. The next one, we're looking at puffing out your cheeks. So hold the lips together, fill your mouth with air, and try and really stretch the tissues around the lips. Okay. Next one, this is the best one to do when we are all looking at each other. I'm sorry we're not all looking after each other because I'm going to ask you to make an exaggerated smile so that you're really pushing that stretch around the lips here. And you might feel some tight areas around your lips on doing this if your mouth is particularly affected by your scleroderma. Halfway there, hand again on the jaw. We're going to take it all the way to one side. And then back to the middle. And the same the other way. Next one, poking your chin forwards. This is easier to show side on, and you're pushing the chin forwards to feel the stretch, perhaps at the kind of top of the neck, but also around the jawline there as well. Now, the next one takes a little bit of an explanation. This is what we call the silent scream. And we're really stretching this tissue on the front of the neck that can be quite tight for some people living with scleroderma. So I'm going to ask you to open your mouth and then look upwards. Once you've done that, that should be a moderate stretch on this tissue here with the mouth open. To then really improve the stretch, you close the mouth such that everything tightens up even more in this area and hopefully gets that good stretch that will get it moving better in the long term. Okay, so that's what they call the facial grimacing. And those were the exercises we were teaching until 40 years ago, before my time, I should say, in the NHS. These days, we've now got these oral stretches where we found we can improve things by getting involved to pull things a bit further. And this is where we have to rely on the function of your hand to do this. So we're going to pop our right thumb in the left side of the mouth and pull it out to the side. Rest back down, and then we'll put left thumb in the right corner of the mouth and take it out to the side. Again, this should be moderately uncomfortable but not painful, and it should be without ulcers or skin breakdown on the lips. And then the final one is both at the same time. So the picture here is index fingers. You can do it with thumbs, and I can't talk at the same time. We're pulling across to get that stretch sensation all the way around the lips, holding it for about 10 seconds. Now, if this is a routine you're doing maybe once a day, maybe twice a week, 3 times a week, you will find the tissues do start to loosen off, ideally. So if that's the kind of general routine, we've now found this, what's called oral augmentation can work quite well, where we use soft wooden sticks, so tongue depressors that the dentist will order, and we put them between the teeth, from the premolars on one side towards the molars on the other side. Yeah, there's an image of where they're going, about where that purple line is on one side. These are the tongue depressors. We do provide them if you come and see us in physiotherapy. If not, you can buy them online for about £4 or £5 for a pack. And then you insert them in the mouth. For me, I think I managed about 12 tongue depressors there. For somebody with very tight mouth issues of the scleroderma, it could be you start with 4, but then after a few months, you can move up to 5 or 6. Now, this is a bit of a Marmite exercise. You'll either love it or hate it, is my experience when I've taught it to lots of people over the years. This microstomia, where the mouth doesn't open so well, is often accompanied by xerostomia, where you get a dry mouth. And if you have a very dry mouth, you might have treatments for that. But I should say one of the slight silver linings or benefits is this exercise is much easier if you do have a bit of a dry mouth. If you are prone to a wet mouth, when you do this, you may well salivate and you'll end up with a bit of slobber dribbling down as you're doing this stretch, which is fine if you're at home alone and it's working for you. But putting these tongue depressors in and leaving that mouth clamped open for 5 minutes a day can have quite a significant impact on improving the mouth stretch, which, as I say, will make eating easier, talking easier, and dental care easier. So that's the kind of the research out there, the general concepts that we think are going to be helpful for you. What I should say, one size does not fit all. And just because there's an exercise I've recommended today doesn't mean it's the perfect one for you. And if you come in and see me and say, actually, I've been stretching my finger a different way and it's kind of working, that's great. If it's working for you, that's all we need. We don't need everyone to follow exactly the same script, but there are some recommendations of the best kind of exercises to do. And the best exercise is the one that you do regularly. So I think I'm pretty much wrapping up now. Let's see if I've got another slide to go. Oh, no. So, yes, I think that is wrapping up. So that's a slightly dated picture of our team at Salford. I've talked through the hand stretches and the mouth stretches, but the crucial bit that it's auto-assisted. So you push that stretch a bit further. If fitness is something that is important, and it should be for all of you, think about grading that. So slowly building up your fitness. We are fortunate at Salford to have a warm water pool. And for those people where the skin is significantly okay and not broken down, they can find the warm water quite good for the Raynaud's component of the scleroderma. And it's a good place to get that cardiovascular fitness going and the stretches going. It's an NHS pool, so we're allowed to offer 6 sessions. However, we then hire it out to former attendees as an evening or afternoon service for, I think, £3 a session at the moment. So you may well not be near enough to Salford to access that. About 50% of hospitals in the UK on latest survey have access to a warm water hydrotherapy pool. If not, you may be able to find a warm enough pool somewhere that is not in NHS facilities, if it's something you'd like to try and if you think it might help. It could be a local fitness class is the answer for you, and you can get discounted access based on your scleroderma diagnosis. I would recommend once a year thinking about monitoring your flexibility, your fitness, some way of measuring it to see how are things going. It could be you want to do that whole body stretch review to see what your movements are like. Oh, and this is an advert for what we do at Salford once a year normally, although we've missed it this year, sadly, due to short staffing. We invite all of our patients to come in and we talk about various ways we can improve outcomes with the different multidisciplinary team we have in our rheumatology department. So the aims of today's talk was to review that evidence base behind what we do, but also think about how you can do it for yourself and make a difference to your outcomes through those regular habits. So thank you very much for listening, and thank you once again for SR UK for the invite to talk. We've got a few minutes from my clock, and there's a few questions that have dropped in. So I'm just going to stop sharing slides, and Ryan's back with us. So shall I hand over to you, Ryan?
Yeah, that'll be fine. Yeah. Yeah, thank you so much, Will, for that. That was really informative, and I hope everyone else thought so as well. Like you were about to say, I think we're going to go on to the Q&A section, which I can see there's quite a few questions coming in already. So while what I was meant to say at the beginning, I'll keep it anonymous, so don't feel afraid to pop questions in there at all. Yeah, let me just have a quick look through here. There's one question earlier in the presentation just asking, is it possible to have this list of physiotherapists when you were talking about the newsletter that you were doing?
Yeah, that's a good question. GDPR means I can't release that, so I'm not allowed to share the list. It could be worth just looking at your local rheumatology department, and if they don't name the physiotherapist, they will at least give a phone number for the team, so you can give them a call and find out who is your local support person. It could be the physiotherapist at the hospital. Like I say, I would hope even the physiotherapist who's based at your GPs, perhaps, they will be able to support you and help you with your exercise goals. They might just need you to come in with a leaflet from SR UK saying, this is what I want to do. And then they'll measure and help you kind of get through that routine. So anybody who's a physiotherapist will help you do that. I should also say it could be your exercise instructor, your chiropractor, your person who works at the gym. Everyone's there to support. And I would really advocate for people with scleroderma feeling happy to have that conversation. And please don't be ignored by your gym instructor who says, oh, you've got scleroderma, I don't know that. You best not do anything too much. Just go on the treadmill for a bit and walk and then go home. Don't be fobbed off. We need to get you exercising. We need to get you maximizing your potential. So please do let SR UK know if you're not getting the kind of support you want from those kind of places. And we will perhaps have a word with them to say, come on, there's no limitations here. We really need to improve outcomes for people living with scleroderma.
Thank you, Will. There's a question here about extreme tiredness. Someone who had quite a lot of energy before the diagnosis, used to be quite active, now has lost lots of energy. Is there any physiotherapy that can help with this particular problem?
Yeah, this is interesting. And actually, I was digging through my slides earlier today, and I did a talk specifically on fatigue and scleroderma for SR UK a number of years ago. And it was somewhat similar to what we've talked through. And this is unfortunately one of the problems of living with an autoimmune condition, is that your energy levels are drained by the kind of inflammation that's happening in your body. So it could be just getting a medical review to ensure everything is appropriately treated, because it could be your medications, your medicines need a slight twitch to allow that fatigue to better settle. Or it could be, unfortunately, pushing on through the tiredness to try and improve general fitness, which will get your heart and lungs working a bit better despite that. So yes, we do work with people in physiotherapy where tiredness, fatigue is the main problem rather than pain or limited movement or whatever. So you can seek advice for that. Also, an occupational therapist could be useful. But I think first angle is make sure you've had a medical review from your GP or your rheumatologist to ensure all your tablets are appropriate and tiredness isn't side effect to the medications or a lack of response, or potentially related to a deficiency of vitamin D or iron levels or something else. So I'd suggest if there is an extreme tiredness, a medical review would probably be wise first. But after that, if there aren't angles they can improve it, then a physiotherapist or exercise instructor will help with gradually increasing activity to hopefully control some of that tiredness.
Thank you. One here, I have limited systemic sclerosis, but I'm still in full-time employment. Walks about 15 to 20,000 steps a day, sometimes carrying rather heavy items like 10 to 15 kilograms. The past few months has had a lot of tight muscles in calves and thighs, leading to sciatic cramps. Wondering whether they should just concentrate on flexibility stretches.
Yeah, and this is really interesting, and this is where no two people are the same, in that some people living with scleroderma are unfortunately exceedingly limited. But this example, 15 to 20,000 steps and, you know, carrying heavy weights is fabulous as an exercise routine. And I think if you are working as a farmer, it forces you to keep active to a degree, but this is concerning that things have got worse in the last few months. It could be a flare of the scleroderma, and as suggested, going back to flexibility and stretches seems wise. Going through that routine and seeing, well, which areas are tight, and if there is a tightness to the hip or the back of the knee, perhaps with the hamstrings or something, there may be a target to work on that would make the rest of those things better. So yes, perhaps flexibility stretches to support the 15 to 20,000 steps could be a way to just check if this is a bit of a muscle response tightness and a slight flare that hopefully could be improved by some focused work. Yeah.
Okay, thank you. Let me see here. Someone asking whether you're able to recommend exercise for pre and post spinal operation. Somebody who has scleroderma with ILD.
Interstitial lung disease. Yeah. Okay. Yeah. So yeah, absolutely. Pre and post spinal exercise is important to maximize movement and fitness before the op and to recover rapidly afterwards. I think that will be less scleroderma specific. So going to the surgeon and saying, who's your physiotherapist? I really need to maximize my potential before I have that operation and recover rapidly afterwards is worth doing. And there will be a spinal physiotherapist who can advise specifically on that, or they might give an exercise sheet. The crucial bit, again, as per the gym instructor scenario, is not to be told, oh, you've got scleroderma. I'm not sure we should do anything for your exercises before or after the spinal operation. No, 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 that's not true. You need to do the same kind of things to the best of your capabilities. So digging into those specialists who work with that surgeon will kind of support that plan.
Okay, thank you. One here, if you don't have any mouth tightening, is it still a good idea to do the mouth stretches?
Yeah, good question. And this is kind of the MOT kind of approach to the annual review of just checking how things are. So I think if you don't have mouth tightness and you think you're moving pretty well and your overall mouth opening is good, it could be just worth digging out the mouth exercise routine once every few months and just running through it for a couple of minutes and saying, well, does this feel tight? Have I got as much movement as I used to? Because things can creep up. So I think any area, if you don't have any symptoms or tightness at this stage, just check it every few months or twice a year to see if there are problems. But I think there's so many other things to manage with scleroderma that if you don't have mouth tightness, then probably a daily routine is not best use of your time.
I guess this could be like a part two to that question, is how does inactivity affect the different parts of the body?
Yeah, and this is interesting because the scleroderma is so different person to person. If you're living with what's been termed as limited aversion, then it tends to just be elbow downwards, knee downwards, where we get the skin tightening, the issues of the restricted movement there. If you've got diffuse, it could be anywhere in the body that you'll have those issues. So depending on the version of scleroderma you're living with, it can have a different pattern of impact. But like I say, it's not necessarily set in stone, that, so it's always worth just checking all parts of the body to see what impact you've had. Different parts of the body, my job is your muscles and your bones and your joints. There is probably a very different answer with regards to your lung and your heart and your liver and all the other parts of your body, but that's not me that's going to answer that particular one, sorry.
A quick one here. What temperature is the warm water pool at Salford?
Yeah, so if you go for your standard pool, perhaps in your community leisure centre, it might run at somewhere around 20 to 22 degrees centigrade, maybe a little bit warmer, but it's early 20s. Back in the olden days, we used to run at 30 degrees. We don't run that anymore. It's too hot to allow you to then get your heart and lungs going. So we run at about 27, 28. And that's the level where we find people living with Raynaud's tend to find that the Raynaud's doesn't flare. They're pleasantly warm to do the exercises. If you don't have a hydrotherapy pool nearby, it's worth speaking to your local council pool or your gym and seeing what temperature they run their pool at to see if it might work for you. And also perhaps look at their timetable. Certainly for one of our local pools, they have a disabled swim every Tuesday afternoon. And for the disabled swim, they pump up the temperature. So if you book in as soon as that session finishes, you'll be in the pool when it's at its warmest, you know, of the potential 7 days a week. So if you'd like to try that, and if the warmth of the water is important, which for most people with scleroderma is, it's completely valid to ask your local pool what temperature you're running at. Do you have any times when it's a bit warmer? I'll pick out one of the questions. But someone's just asked, they can't wait to see the slides so they can start doing the exercises. You don't need to wait to see the slides, start doing the exercises. They're all on the SR UK website right now.
Yeah. So somebody asked, do you recommend lymph drainage sessions?
Yeah, I saw that question. This is really good. And this does correlate to that Italian study that I mentioned, where some of the people in the study were getting that 2 hours a week of manual therapy, which is probably quite similar. And we think it may have worked in relation to lymph drainage there. So if you have a specific issue with your lymphatic system, that means you have areas where you get distinct swelling that's limiting your movement and your exercise capabilities, you will be referred for specialist lymph drainage type treatment. Outside of that, we're not sure what impact it has if you've got a normal lymph system to then be working on those lymph drainage treatments. So if there's a specifically identified medical concern, yes, they'll help. Outside of that, we don't see them scientifically or from the research to date to be any better than your exercise bike, your treadmill, your hydrotherapy pool, or whatever becomes your regular exercise routine. Because by doing that, that will drain your lymph as much as lying down and somebody massaging you. So probably a more active option is better for most.
Thank you. And then the last two questions, can scleroderma cause stiffness around the hip area? And can you recommend a good cream for tightening skin?
Yeah, so the first question, yeah, potentially, particularly if you've got the diffuse version of scleroderma, you can get tightening in any area. So it could be the hip stiffness is related to your scleroderma, directly tightening up the tissues around the hip. It could be if your scleroderma is impacted on your feet and you're walking a bit differently, that in itself can cause the hip stiffness. So it can be just seeing if there's a kind of knock-on effect from an established issue that's then felt further along the body. And then the good cream for tightened skin. Yeah, I think there is a good evidence base towards a habit of rubbing something onto the tight skin. There's not a particular cream we recommend, although I'm going to go back to the farmer who was in the chat earlier. And the most distinctive conversation I've had with somebody living with scleroderma is they were a farmer and they'd found the cream that they used for the cow's udders was the favourite thing they'd found to then use for their hands. I am not recommending udder cream. Anything that is on budget and helps for you is worth doing, so long as the skin isn't cracked or deteriorating. So I don't think there is a winner for best skin cream, but there is a definite winner for regular use of whatever's on budget and you find helpful. So I hope that's not too vague, but I wanted to keep lots of possibilities available for everyone.
Yeah, no, that's great. Yeah, thank you, Will. And yeah, just to finish up, if there's any questions that you guys think of later, you can always email us at SRUK. It's SRUK, no, sorry, info@sruk.co.uk. I'm sure we can get questions to Will at a later date as well, possibly, and we can get back to you guys. So yeah, thank you all for coming out, and thank you, Will, for presenting for us today. Yeah,
Great.
wrap it up there.
Best of luck.
Thank you. Bye, everyone.